In this film, we're going to tell you what to expect when you have a lymph node biopsy. A lymph node biopsy involves the removal of a small portion of a lymph gland. The lymph glands are small organs used to help your body to recognise and fight off infections. They're found all around the body, but are most easy to feel in the neck, armpit, and groin. The biopsy is used to identify the presence of certain medical conditions or to find out how widespread an existing condition has become. The results of the biopsy help your doctor decide about further tests and treatments. The hospital's radiology department will contact you with details of your appointment and will send you any necessary written information. You'll need to sign a consent form before your procedure. A nurse or doctor will go through this with you, and you can ask as many questions as you like. You may need some special blood tests before the biopsy is done. If you're taking blood thinning medications such as warfarin, dabigatran, rivaroxaban, tinzaparin, clopidogrel or aspirin, you may be asked to stop this for a period before your procedure. Please check with the team who are going to perform your lymph node biopsy. You may be asked to change to a different short-acting blood thinner for a few days before the biopsy. You must tell your nurse or doctor if you've previously had an allergic reaction to any local anaesthetics. You can eat and drink normally before your biopsy procedure. The biopsy is carried out by a doctor. It takes about 20 minutes. The biopsy is carried out under local anaesthetic, which numbs the area from which the biopsy sample will be taken. The area of skin around the biopsy site will be shaved if that's necessary. Then it will be cleaned with antiseptic wipes. Local anaesthetic will be injected. You'll feel a brief stinging before the area goes numb. A scanning process called ultrasound is used to ensure that the biopsy sample is taken from the right location. A sensor is placed against your skin and the scan is viewed on a monitor. The sensor can feel cold on your skin, but it's not painful. The biopsy is carried out using a fine needle. The ultrasound is used to check the position of the needle inside your body. You shouldn't feel any pain because the anaesthetic will prevent this. You may briefly feel a slight pulling sensation as the sample is taken. After the test, the nurse or doctor will apply a dressing at the site where the test was carried out. Sometimes your doctor may recommend a small operation to remove a whole lymph node rather than just a biopsy. In this case, the procedure would require a short anaesthetic and admission to hospital as a day patient. Sometimes a biopsy is taken while you're scanned in a CT scanner. The biopsy sample is sent to a pathologist for analysis. It can take several days for the results to become available. After the biopsy procedure, you should feel normal, with only an area of numbness where the local anaesthetic was injected. As the anaesthetic wears off, you may feel some discomfort. If this bothers you, you can take mild over-the-counter pain relief, such as paracetamol or anti-inflammatories. You should keep the biopsied area dry and clean for 2 days after the biopsy. You should be able to return to work on the day of your biopsy or the following day. A lymph node biopsy is a low-risk procedure. Very rarely, a person will experience bleeding from the site where the test was carried out. Even more rarely, an infection can develop. If the area bleeds when you're at home, apply pressure to the site until it stops. You must tell your medical team straight away if the bleeding continues, if the site becomes more painful, red or swollen, or you get a high temperature after you go home. You may need antibiotic treatment. Your test results will be discussed when you next attend the clinic. If there's any reason why your medical team needs to see you sooner, they'll contact you and arrange an earlier appointment. Sometimes biopsy results are inconclusive. If this happens, then the biopsy may need to be repeated. If you have any questions or concerns about any aspect of your lymph node biopsy, you should contact your hospital.